collaboration and equilibration. I had a lot of good results, but there were a certain amount of cases, because I was starting to ask why, was the fact that my patients were having to come back 10, 15 times. And I know I was excellent at equilibrating. There were a certain percentage of those cases that were coming back multiple times. And I didn't realize at that time the jaw was coming down and forward. We kept thinking the jaw keeps seating. But in reality, they really were coming down and forward now with this mindset. And one case that really came to mind was when I bonded the lower anterior teeth because they were all worn down. I thought I was doing the right thing, equilibrating her in this uppermost, midmost type position. And the patient kept coming down and forward, and eventually I was just honing down slowly but surely all the bonding that I had put on right back down to the original. And at that point in time, I had this realization, I don't know what's going on here. And when I saw that, I was beginning to search for answers. Now, it wasn't the fact that I was having a pain practice, because oftentimes my presentations are always showing pain, right? The reason why I presented the pain part was because it was pressing the paradigm in my book of the more difficult challenge cases of what paradigm or proven philosophy can we deal with to address the difficult case, because if we could, then the easier ones would follow through. So in my practice, as I began to take on these concepts, I recognized that there were more pain issues because I didn't know what I didn't know, and I was asking the questions to my patients. After we equilibrated, how are you feeling? They'd say, my face feels sore. Then you have to ask, why is the face feeling sore? Because they're never going to tell you, doctor, I have a lot of pain. Rick, can you help me? They don't tell you that because they don't think we are treating pain problems, because they believe that we're treating dental problems. And dental is things that we do on teeth. But they don't recognize the things that we do teeth indirectly